Hello, everyone. Thank you for joining us for today's webinar. My name is Ashley Riggle, and I am a Customer Success Manager for Yellowfin. Joining me today is Imran Ahmad from iPASS. iPASS has partnered with Yellowfin for the past 2 years to bring Yellowfin's reporting and analytics capabilities into the iPASS patient revenue cycle product. iPASS helps healthcare providers by simplifying the patient check-in process and has enabled increases in operating income for providers. In this webinar, Imran will be highlighting how, in these difficult times, the iPASS team has been able to deliver incremental value to their clients across a variety of healthcare clinics using Yellowfin's business intelligence capabilities. Specifically, he'll be covering how the iPASS platform has improved operational efficiency using business insights, how the tracking and reporting of key metrics helps to drive accountability, and how having the right information at the right time can help in the area of COVID-19 and beyond. So without further delay, I'll hand it over to Imran.
Thank you, Ashley. Appreciate the kind words and the introduction. And as you mentioned, we've been partnered with Yellowfin for a little over 2 years and have had an incredible experience really transitioning from a homegrown system that we were using internally to something that has far more sophistication and capabilities on the Yellowfin platform. So what I'm going to talk about today, as Ashley mentioned, is I'll start off with a little bit about iPASS. And because we're faced with the challenges of a COVID-19 world, I'm going to transition a little bit into some of the practices that we work with. Because to give everyone a little bit of foundation, we work with medical practices. And specifically, we work with medical practices on payments. So anything that is patient payment related, we really try to touch. And that includes everything pre-arrival to the point of service to even after that patient leaves the door. So when you think of iPASS, it's really critical on the path to a physician practice's overall health and well-being. We're able to track different payment methods, different payment types, and specifically collect on the behalf of the practice. So with the COVID-19 world, we really saw volumes drop dramatically, and I'll show you a little bit about those aspects. But I want to start off with a little bit of background on the company and what we do. I start off with this only to give some sense of scale. We've raised $15 million from folks like Fifth Third Bank and QED, which is the founders of Capital One Bank. So for us, providing our clients with a sophisticated, financially savvy experience really runs in our DNA, going all the way down to our investor base as well. And the main problem and challenge that we as an organization are trying to solve and adjust for is the fact that the healthcare landscape has changed. It used to be 20 years ago, a medical practice would collect maybe 5% of their revenue from patients. So we were looking at smaller copays, and now that has really shifted dramatically, such that high deductible health plans in the United States are the norm. And overall, we're seeing a revenue of an orthopedic practice, for example, about 25 to almost 30% of their revenue is coming directly from the patients. So it leads to a really interesting dilemma, because you can collect from insurance companies and they pay pretty regularly, and you collect about 97 to 98% of the dollars that are available when you're collecting from insurance companies. However, when you're collecting from patients, it's a very dramatically different overall profile. So when you look at patients, unfortunately, when you're trying to collect from patients, you're getting on average 55 to 70% of the patient dollars that are available. And to give you a sense of scale, if you're a $10 million revenue orthopedic practice, because we work with a lot of elective procedures, 25% of your revenue is now coming from patients. So $2.5 million of your $10 million of revenue is coming from patients. And if you're only able to collect 55 to 70% of that, you're leaving almost $1 million to $1.5 million on the table completely. And through our partnership with Yellowfin, we've been really able to give these practices the tools that they need to help drive that efficiency to collect from the patients. So with our Yellowfin insights that we're providing to the practice, we can hone in at a practice level and obviously optimizing with our software, provide the insights to the practice to drive the patient yield to 90 to 95%. And at the end of the day, that's higher operating income. You're getting the money faster through Health iPASS. And we're really trying to develop an outstanding patient experience, which sounds counterintuitive. How are you getting a better patient experience while collecting more from the patient? And it's really because it's not that patients don't want to pay or can't pay. It's the platform and the process today is just abysmal. I mean, think about when you go to a doctor's office, you come back, you see the doctor, you don't know what you're paying for anything. 5 weeks later, you get a paper statement in the mail, and you don't even remember what it was for half the time. And very often, you let that statement sit there until insurance adjudicates the claim, and there's back and forth process, and it's really pretty terrible. And what we saw, and this is just data from the over 3.8 million check-ins that we do at Health iPASS, is as a result of COVID, we saw a dramatic drop-off in obviously elective procedures because they were canceled across the country. Practices were being shuttered. People were furloughing staff. They just didn't have the resources within the organization to handle the staff demands because the staff was now getting overwhelmed. You furlough half your staff, the staff gets overwhelmed. And what we were able to do with Yellowfin is provide the teams and the medical practices that we work with very tangible weekly insights so that they could navigate through the experience and dilemma. And I'll show you some of those reports as we get down the path. But it was really the BI tool was a saving grace for these people because they saw a 60%, as you can see, drop in payment volume. And now these practices are suffering, obviously, financially. And the question of the day is, how can we drive and optimize collection from the patient? How can we do so in a way that's not burdensome to a patient who may have lost their job? And how can we do so in a way that makes the staff that we do have accountable and we can gently nudge them to go in the right direction? And that's really what we did. So again, just providing a little bit more framework as to what Health iPASS does. We have 3 methods of engagement. We do so pre-arrival, at the time of service, and post-visit. And we've morphed our pre-arrival platform to really do things like appointment reminders, and then from the appointment reminders, being able to pay past due balances, pay co-pays. We're running real-time insurance eligibility, and also the ability to complete forms. What means in a COVID world is a virtual check-in experience. So can you do this in a virtual waiting room type mantra? And that's what we've built. And that starts with the pre-arrival. At the point of service, if they didn't complete things pre-arrival, we also have these check-in kiosks where they can do the same exact things, post demographic changes, collect payment assurance. And all of this on the back end is powered by Health iPASS, but also by Yellowfin. And Yellowfin is really the engine behind the scenes that's allowing the practice to really have the insights so that we're collecting the money where we are collecting it. How are we collecting before in the pre-arrival standpoint? Can we optimize around that? How are we collecting at the time of service? Can we optimize around that? And similarly, on the statementing side. But we've used it for far more than that, because we're also tracking and using Yellowfin to track communication history. How many times are people getting text messages, and giving the practices the ability to audit their workflows so that they're not wasting their time and energy on things that aren't revenue producing or aren't patient care facilitating, and are leading to bad, at the end of the day, patient experiences, which results in bad reviews, which overall, a medical practice is a business like every other organization. And if the patient's not happy, they'll go somewhere else. And we supplement that on the back end with e-statements and payments. And so the questions that we were trying to ask were, how can we provide transparency to our clients to show them a very clear ROI? And within the medical world, if any of you have experience, customizations are essential. And every client runs things slightly differently. And when we had developed this homegrown business intelligence solution, it just wasn't cutting it. We couldn't do the level of customizations fast enough. And so we went through a pretty rigorous evaluation process, looking at over 7 different business intelligence tools. And we honed in on Yellowfin because of its ability to customize quickly. The team was able to pick up the tool set and really make it their own very quickly. But because of the guardrails that we have within Yellowfin, we could generate beautiful, sophisticated reports on behalf of our clients in a way that allowed them to intuitively manage. And what you're seeing on the screen right now is just a flavor of some of the reporting that our practices are using daily to help manage their workflow. And I'll go into the details on some of these just to give you some perspective. But all of these reports are powered by Yellowfin, and really the ability to, for example, hover over individual items, as you see here, and get granular breakouts. And prior balance collection is X, copay collection is Y. How are we doing on deposits? That level of flexibility and that level of insight is not something that medical practices were used to having. And because of that, for example, what you're seeing here on the screen is we're able to show, hey, this is your total collected. So in this case, it was $155,000, but available collections were $183,000. So you're doing okay, but not, you can do better. And then how that breaks out in terms of prior balance collection, copay collection, and so on and so forth. And then breaking that detail out, both graphically, so that I could see very high level, office by office, location by location, how I was doing on each individual metric. But one of the best things about it is I could also have that available from a chart format so I could see the individual detail. And that was invaluable for our team, because what we were doing historically before a Yellowfin world was really trying to amalgamate all the different data pieces that we had and put them together in a way that was visually appealing. But with Yellowfin, it was just so much easier. And anytime there was a customization and a group would come to us and say, I need a custom report, we were able to generate that custom report within hours. And that was so impressive to the medical groups that we were working with, because they would have an ask. We would be able to use Yellowfin to turn around that ask and make it something that was tailored to them. They would say, I'm used to looking at things in this way. Well, you know what? Now, because of the Yellowfin and the power and capabilities that we have, we were able to furnish that and do that for them. So that flexibility to create those beautiful visuals on the fly was so critical to us. And then the last thing is what they did on the user level adoption, so we could drill in. They could click on any individual office location and then map it to front desk personnel. So how were my front desk team doing on an individual basis? So was Sophia collecting card on file better than Erica? And if so, can I pair up Sophia and Erica so that they were sitting next to each other? And so the practices that we work with, the medical practices that we work with, we're using these insights in ways that honestly we didn't even imagine. And they kept asking for more reports, and our ability to produce these for the clients resulted in us having weekly client meetings where we would sit with the key stakeholders, give them their adoption reports and their insights in a way that they could actually take action on. And for us as a software provider, that was the best thing for our client success team to give them the scale that they needed. Because historically, they were running SQL queries to find different data. And what we were able to do is present that, have it front-facing in a way that the practice and the client could digest easily. And honestly, for them, they would just plop our reports into their board presentations so that they looked good. And there's nothing better than, as a software as a service company, making your clients look good. It helps reduce churn. It's our way to go forward. And really, the user level data and location data that we were able to provide at Yellowfin helped increase our practice's revenue in a COVID-19 world. And so what we were seeing was the practices who were very aggressively looking at these reports and using it to make their adjustments, to reassign people to different locations, their revenue started to spike up. And now we're seeing the practices that were at 10% volume, 20% volume, they've been able to use the insights that Yellowfin has provided to really reassign their team and reassign their cost components to survive in this time and thrive compared to their peers. And that's one of the statements that we have is Health iPASS helps you collect patient payments, right? But we're also here to help you as a practice make sure that you're growing in the best way possible. And I think the Yellowfin insights and the adoption reports and the various reports that we were able to spin up for these practices has helped them in ways that we could not have imagined in the COVID-19 world, which no one expected this. And going forward, it really helps them optimize their workflows efficiently. So when they're growing and when they're ready to take on the world again, that we are prepared to provide them with the right experience and right tools for them to take forward. So with that, Ashley, I'll turn it back to you. I've covered some of these aspects about why our homegrown reports just weren't cutting it, and the flexibility that Yellowfin provided, and the level of customization that was really essential for our practices to thrive in a world that was uncertain. So, thanks, Ashley, for the time, and I'll kick it right back to you.
Imran, thank you so much for taking the time to share your story and these incredible insights that your customers and your team has gained from utilizing these capabilities with Yellowfin. It's really great to hear the work that Health iPASS has done to make a positive impact on, first of all, the patient check-in process, as well as the impact that your healthcare companies are feeling in the face of COVID-19. And it's good to hear that some of your customers are being able to come back from these challenging times, and hopefully that Yellowfin will be able to help them be set up for success going forward. And as we wrap up today's session, looking into the future, I'd love to hear your thoughts on what's to come with the Health iPASS and Yellowfin partnership, and particularly thinking about the new features and functionality available with Yellowfin, such as signals and stories and assisted insights.
Yeah, no problem. I'm happy to talk about it. We've really taken a front and center evaluation of what tools can we provide our practices that really, as I mentioned, gives them the insights they need. One of the things that obviously makes a ton of sense for us, and I think we'll probably be incorporating going forward, is the Yellowfin Signals toolset. The ability to see basically who's outside of standard deviations and track on a weekly basis. Everything happens in a time series, and the ability for Signals to really call out where there are blips in the data that you wouldn't have been able to see otherwise. I thought that was something that we're definitely going to try to incorporate in some of our reporting going forward. And as we have more of these face-to-face conversations, hopefully when COVID restrictions lift, in the interim, one of the things that we thought was very useful was the Yellowfin Stories platform, because we had the ability to collaborate with the folks on the other side to basically work as a team and call out sections of reports and say, hey, what happened on XYZ date? Can we help? And so being able to collaborate like that in a very seamless way is definitely something that we have on the horizon. It's not something we use today, but we really want to get to the point where we're using stories effectively so that we're engaging with the client again, and Signals to really provide that time series view of where are blips in the data, what can we do to make sure that we're being proactive as opposed to reactive after a couple of weeks of, maybe somebody at the front desk got let go and they were a star performer. Well, we aren't going to know about that until much later. And I think Signals really helps us identify those issues early on. So, who knows where it takes us, but I'm happy to partner with the Yellowfin and see that they're actually developing new innovations that can help us as well. And that's been a big part of the partnership for us, and why it's been great, because it hasn't been a static relationship. The software and the BI tool is not something that, hey, we signed up for once and hasn't innovated. You guys have been innovating on your side too, and I think that's been reassuring to see, because we're trying to be at the cutting edge of technology, and we need a partner that adapts with us to really make sure that we're doing what we can do.
Absolutely. To hit on that point, I definitely agree that the industry is constantly evolving, and I'm glad to hear that you're willing to grow with us.
Yeah, of course.
All right. So I think with that, if you don't mind going to the next slide. Imran, again, I really, really appreciate your time with today's presentation. It's been fantastic to hear the Health iPASS journey. For those of you tuning in today, if you'd like to learn more about Yellowfin or Health iPASS, please visit yellowfinbi.com and healthipass.com. Thanks again for your time, everyone, and we look forward to chatting with you soon.